incredible. I did not know that people flew in for the event, so no pressure on us. That's a whole added layer of excitement. I don't know about you, but I am overwhelmed by just the amount of really incredible, intelligent people that are in this room. It's super exciting. As a woman who's been to a conference before, maybe once or twice in my life, it's pretty rare to see this many women in an audience. So it's a really cool experience for me. And I'm delighted to have Mary Ann with us today. This is going to be a really fun interview. We want this to be fairly interactive, so if you have questions, just feel free to raise your hand. It's a small space, so shout it out. So, Mary Ann, I'd love to start with you telling us a little bit about your journey into the life sciences space. What was really your first foray into the industry?
I am actually a nurse by education and practiced nursing in New York City. Loved nursing, loved patient care, loved the entire art and science of nursing, and just loved the interaction kind of across the healthcare spectrum. But I came to a point where I really wanted to go back to school because first and foremost, I am a nerd, and it was really attractive to me to seek a graduate degree. And at that time, it was 1989, the opportunities for advanced graduate degrees for nursing and what they led to as far as your ability to work independently were very much more limited than they are today. And so I took myself to a recruiter, to a life sciences recruiter, and she did some personality testing and then talked to me a little bit, and she pointed me towards pharmaceutical sales, which, if everyone remembers, at that time, that industry was growing very, very rapidly. I had a bunch of interviews with different companies, some very interesting experiences, but I was fortunate enough to land at a J&J company called Janssen Pharmaceutica, and that was really the start of my career, and that was back in 1989. And that was my first exposure to life sciences outside of patient care.
Sure. So having that experience rooted in patient care, how has that influenced your day-to-day in the industry?
Oh, it's seminal, and it's kind of always present, because when you're a nurse, and a great charge out there to all the nurses who are out there, when you're a nurse, it's a very simple mandate for how you work. Patient comes first, always. Every day, all day long, patient is first. And that's a really great mandate to hold yourself to permanently in life sciences, because if you never lose sight of the patient and you never lose sight of the fact that you have this incredible responsibility and almost obligation to help, to deliver value, then it really keeps you very humbly rooted in what you're doing, and it keeps you very aware of whether what you are doing is adding value. And that's just how I've conducted myself my entire career.
Yeah. You know, we hear from a lot of life science leaders that having the patient first in mind is essential. So it's nice to hear you echo that. So you land at Janssen. What was your first charge there?
I was a sales rep. And interestingly enough, I was in the Connecticut and Western Massachusetts area. That was my first sales territory. And I quickly appreciated that everything matters. So I'll say that the drugs that I represented first, one of them was an antihistamine, a fairly simple drug category, and another was an antidiarrheal. So not really rocket science, but still very important. And I always felt that as a representative of my company, it was incumbent on me to know more than anyone about my drugs, because sitting with a doctor or talking with a doctor or a nurse, you're talking with someone who has to routinely and at any given moment select from hundreds of different drugs, therapies, or procedures. And so I always kind of held myself up to having the highest level of knowledge about what I was doing. And that's, I would say, another constant that just can't steer you wrong if you kind of hold yourself to that. So I was a sales representative. It was an incredibly exciting time. The industry was still very open. Doctors wanted to hear from us. Office staff wanted to hear from us. And I was a sales rep for about 3 years, and then promoted up through management. And then at a point not too far later, I was given the opportunity to come inside to a marketing job, which was the first time that my very strong science background wasn't really the most prominent feature that I could bring to my role. And that's where I really started challenging myself about learning anything else I could get my hands on from a business perspective.
How did you tackle that kind of a transition?
I'll say it was easy. I was at J&J. There's lots of great companies out there. J&J is certainly one of them. And the thing that I really look back and see most now is that they were absolutely committed to all of their employees. If you were an employee, they got the value proposition that if they invested in you and continually made you better, two things happened. You became loyal, and I was at J&J for 20 years, and you just became better at being able to be a general value contributor across the business. So I was the very welcome and very eager recipient of lots of training along the way and lots of exposure to other people.
Did, reflecting on, you said you were there for 20 years? Reflecting on those 20 years, what are sort of the big picture lessons that you pull from that time?
I think this is why we're here today, perhaps, and one of my greatest lessons is if you do not ask for it, you will not get it, because there's lots of people out there willing to ask for exposure, opportunity, or some type of difference from what they're doing. And I was very fortunate that given the way the companies were growing at that time, there were lots of new opportunities, and I quickly got myself into almost a pattern of looking for things that were different from what I had been doing that would stretch me in a different way. I also went back to grad school, so I had an executive degree in management, and that was also another incredible kind of immersion in a level of business people that I had never had exposure to. Many of them were finance folks from New York City because I was at Stern, but they were just incredible professionals, and the nuts and bolts of leadership and of contribution transcend lots of different career titles, and I was fortunate to have that type of exposure my whole way through.
So you spend 20 years at Janssen. What's the path to Lantheus?
So 20 years at J&J, I actually was at two different operating companies within J&J, another opportunity and another opportunity where I met who has been my longest standing female mentor, because she was the president of the company that I joined, which was a company that had been acquired by J&J. I look back on my career and realize I had the opportunity to do everything I wanted, and I was welcomed and embraced for being what I am, which is an eager nerd. And that's just a very honest description of myself. People let me use my energy for anything that I was willing to point it at, and I was rewarded for it along the way. I got to a point, and this is more about corporate evolution than it is about J&J, but I really wanted an opportunity to challenge myself again and try to become a general manager, and that opportunity just was not going to happen soon enough at J&J. And so I left, went to another company, had the experience that we all say is good but we really don't want, which is a failure, because our company, we did have to close the company that I went to as president. And then from there, a great gentleman friend of mine who has been a mentor friend for my entire career was the CEO at Lantheus, knew that I was free because we had just closed the company, and asked me to come up and help him kind of reset and correct the company from an operational and a strategic procedure. And I joined sight unseen. I had never, my first day that I saw the campus was the day I showed up for my first day of work. But I trusted that my mentor and friend had me making the right decision, and I guess he did.
Yeah, and I think we're going to talk quite a bit about mentorship. Something that you've mentioned a couple times here is you had this goal, you had this thing that you wanted to do, and so you went out and you asked for it. And I think for a lot of people, that's scary. That's a scary thought. How do you do that? How do you just ask for the thing you want, particularly in a corporate culture that might not be receptive to you asking for it?
I didn't operate in that type of culture where it was not welcome or rewarded. But my true belief about leadership is that the most important component of it is courage, because courage makes everything else possible. We do it in every other part of our life. We have the courage to raise kids in today's world. We have the courage to leave our house every day. And from a leadership perspective, that is really the most common trait that you'll use in anything you do. What has to sit right behind it is your own confidence in yourself. And that, again, the audience that is here, there's not a single person, man or woman, in this audience who should not, for having done what you've already done, have the confidence that you can use those traits to do anything else you want. There's really a very common theme about how to lead people, how to treat people. And as long as you hold true to those standards, you will be successful at anything you want. The world desperately needs leaders. Our industry desperately needs leaders. So it's almost our charge and our obligation to step up and fill in those spots.
Yeah. So, you've mentioned a couple of times here that you've had friends and mentors throughout your career. In your mind, I feel like whenever we have a conversation about women in science, the topic of mentorship comes up. For you, reflecting on your own career, what has been the value of mentorship?
It's simply who I am. I mean, I shamelessly looked around me my entire career and saw great people doing great things, either thinking different ways or coming at situations different ways. And I modeled what I liked and what worked. And I also learned about myself what didn't work for me. And that's a form of general mentoring that just can go on every day, all day long. In addition, though, I have been very fortunate to have a group of relationships, many of them with men, because that's what was most around me for most of my career, but just great guys, great professionals, along with then the women I was able to meet who were open to asking, to having someone ask, hey, what do you think about me in that situation? Or what do you think about if I want to ask for something? And again, if you don't ask, you'll never know, but I'm going to believe, for the way I handle myself, that people want to help and people want to give. And if you ask and if you're sincere, then people will continue to feed energy into you for what you're trying to accomplish. And I was just incredibly lucky. My first female mentor now sits on my board. And she's accompanied by a gentleman who I always thought was the smartest man I ever met at J&J, who I've also known for 20 years. I reached out and asked them, almost as favors. My company is small, and these are two long-lived, highbrow executives, but I asked them to join my board and help me, and they did, because if you ask, you get more than you think.
So, tangibly, what was the structure? How did you structure these mentorships? Were they like highly structured things? Were they more, kind of fluid, like a friendship would be? I mean, what did it look like sort of day to day?
I, again, very blessed in my career at J&J. They took mentoring very seriously, and there was a very formal process for assigning not only internal mentors, so other employees, but also external coaches, especially if you were in a development track. So I've met a lot of folks who are really professional mentors, and I would say the commonality that you always find is that your mentor is right for you if they challenge you and don't console you. We don't need consolation, especially given what we all do, but we do sometimes need to be challenged and have someone tell us that it's all right to go the next step and try something. I try to give that now back to folks. I'm so fortunate. I had a call last night from an incredible woman who's a friend of mine who used to work for me, who now we have this relationship, and she knows she can call me any night and I'll pick up the phone, and I think that's what good mentors do. If they're sincere and if they're for you, then I think whatever the communication is, email, text, phone, they pick up when you need them.
For the people here in the audience that are looking to establish that kind of a relationship with someone they consider a mentor in their life, what's the first step?
I think you have to ask, because you're asking for someone's time and you're asking for their commitment and their energy. We're all incredibly busy. We all have very, very busy lives. And so it is a request, and it's one that you should honor by bringing the type of conversation that has a goal or takes you forward in some direction for having had it and for having used somebody's time. But I think, again, my experience and the way I try to behave now is that it's a much more willing relationship than you may give credit to. And people, from a humanity perspective, people want to help and people want to feel like they have value. And that's what a great mentor can do for somebody.
So, I was taking a look at one of the boards we have back here, which was a timeline of where people are in their careers. And it seemed like about a third of the audience who's here today is sort of just starting in their career path. What's your advice for those people?
Work long and hard. I'm 59. I say that because it's published, because we're a public company, so there's no use trying to hide it. And I believe honestly also that at any point in your career, age and title are irrelevant. They have no hold on what you can become. There's a question that I very frequently ask when I'm in a large group, and my question will be, and you can raise your hand if it's true for you, whose job title today is a direct correlation to their undergraduate degree? It's very few of us.
Like two
right?
hands went up.
Congratulations. I guess if you're a doctor or a rocket scientist, then perhaps you'll stay there. But for all the rest of us, it's just kind of an entree into, again, building a set of traits that you can apply anywhere you want to and towards any purpose. And I think this audience is another great example of that.
Yeah. So in a minute, I want us to kind of shift gears and talk a little bit about what you guys are doing at Lantheus. But first, I want to call back to something we were discussing earlier, which is you mentioned very briefly that prior to Lantheus, there was a company that you unfortunately had to close on. Failure is something we all have to deal with at some point in our life. It's inevitable, as you mentioned. How did you deal with it?
Okay, I don't agree that we all have to deal with it in our life. I think we mostly do, but everyone says it's one of those muscle building things that you're glad you went through. They always say that in retrospect, not in using future tense as a verb. So I'll add that. But for me, once I made the decision, I was on the management board because I was a president, and I participated in the decision, which was the right decision to close the company. We could not return value in a time frame that was acceptable to us and certainly would not have been acceptable externally. So we made the decision to close down the company. The group of people who worked for me, and one of them was the woman I spoke with last night, my goal then was to use all of my chits, so all of my relationships and all of the relationships I had throughout the healthcare sector to find jobs for every one of the folks who had taken a chance and come with me, because we all knew it was a risk when we joined, and the risk didn't pay out, but I was able to then use some of my energy to help them move very deservedly on in their career. And I think that's another obvious mentor relationship benefit. If somebody knows you really well, they're more than happy to have you, to advocate for you into a position, because it only reflects back well on them.
So, you mentioned that your day when you came in to interview for Lantheus, that was your first day of work. Yes. Can you take us back to that day? What was it like? What made you so excited to just sign on right then and there? So
I was in pharmaceuticals my entire career, and this is a completely different industry. This is diagnostics. Not only is it diagnostics, it's nuclear diagnostics. So this is literally using radioactive material to form agents that are injected into folks and then used to visualize different organs and things under certain types of equipment. I knew nothing. I was walking into a company where the average tenure was more than 25 years. So these were people who knew what they were doing and had been doing it for so long. I was a personal friend of the CEO who asked me to come in. So I also kind of had that sitting on me that they thought I had been slid in for that purpose. So I was intent from day one to show A, that I was ready to learn, B, that I knew nothing and therefore was an open sponge for them to teach me, and that my intent was to add value and to honestly, it was to fix the company. We're now, I will celebrate my 6th anniversary on April 15th. And we are a completely different company. We're public, we're profitable, we're one of the little darlings of MedTech, and it's simply the combined effort of everyone who was there and the intent that we all had.
Yeah. That must have been an interesting culture to walk into, this group of people who had been there for so long, and you're the new person. I mean, you laid out for us sort of those intentions that you had. How did you go about demonstrating that to the employee base?
It's attitude. It's honestly attitude. If people sincerely read that you want to learn and that you value them and what they can teach you, you get an incredibly different experience than if you come in trying to superimpose some type of experience that you think is relevant on them. And I just left myself open to learning from them and to kind of learning the entire field of diagnostics, which is a really cool field to be in. And it worked. It worked for me.
Yeah. So walk us through what you're working on right now at Lantheus. What's in the pipeline?
So as I mentioned, we are very unique because we are one of the few companies worldwide that's allowed to handle radioactive materials that are intended for medical use, so for injection or use with patients. That is a very, very high level of responsibility. We are routinely inspected, oversighted, or checked out by more than 30 agencies worldwide, because when you're allowed to receive those materials, work on them, and then send them back out, there's a lot of people who are interested in what you're doing and how you're kind of securely managing it. The really cool thing that's happening today in diagnostics is that radioisotopes, which is what you use, the radioactive material, that's what they're called, there's so many more uses for them coming into healthcare and into the healthcare model. To date, primarily, they've been used for diagnostic agents because they light up, they are very good at lighting up organs when injected into patients. But now they're being used to kind of drive clinical programs. So during phase 3 studies for products, you can use a radioisotope to tag and ensure that your product is sitting where you want it in the body, that it's having the action that you want in the body. And then even more so, coming out of clinical development, there's now use of radioisotopes for targeted therapy. So this is what we all talk about, precision medicine. This is right action for the right patient and only that patient, because they're the ones that will benefit from it. And my goal for Lantheus is to have us, because we're one of the few companies worldwide that can handle these materials and have such deep expertise. I want to be on the front of that wave, kind of leading that change in healthcare, because it really is a very, very strong value proposition for patients out there.
So you just kind of touched upon that at the end of what you were just saying, but as the president and CEO looking ahead for 2019, what are kind of your priorities for the company?
I see us as a service organization. Again, I think you keep yourself really straight if you know that you're beholden to shareholders, which of course we are, and you're beholden to patients. So my 3 groups are patients, shareholders, and my employees. That drives all of my thinking. Being in the Boston area, I think we have an obligation to be larger thinkers in the healthcare delivery model. Unfortunately, every year we're spending more and more for healthcare, to deliver healthcare. As patients and as citizens, we're paying more for healthcare, and we're not seeing the value return. So for the level of investment we have, we are not the wellest population in either the United States nor in the world, and that's just an inefficient use of time and folks and money. So I do some other groups where that is our discussion. How do we look at the healthcare model and figure out how to get better healthcare to more people and to get it earlier? Because there's just no doubt about it economically. If you get in earlier with good healthcare, available, affordable healthcare, you change the vector of someone's health dynamic, and that has an incredibly positive impact on their cost to society, because they cost less and they contribute more, and that's just a kind of a winning combination. So that's what I'm fully dedicated to, that Lantheus plays a role in that.
Yeah. I think as somebody who is a leader in the life sciences space, people often want to know what sort of trends and topics in the healthcare life sciences space are you paying attention to right now? There's lots of news out there. What are you tuned into?
I am very tuned into healthcare delivery, because in our state, and this is very true in Massachusetts, we have tried to somewhat reform some of our healthcare delivery, and it's been successful, but there are still large groups of people who don't have access to healthcare. And in the absence of access to healthcare, folks go to an emergency room, and that is the least efficient, and it's also the least humane place to receive care. So I would like to see progress made there. The other area that is so relevant for us is mental health, because it's another very, very strong relationship. If you cannot intercede and help folks with their mental health issues, they go on to become less contributors to society and therefore more of a cost to society, and it's all preventable. If you're willing to get in, invest in folks earlier, and screen and offer treatment and have it really accessible, you can honestly change the dynamic of the state going forward, and that's what I would like to participate in.
Any questions for Mary Ann? We've got a couple here. There's one right behind you, Brian.
Can we turn up the lights, because I can't see folks.
Yeah, sure. Maybe we could get someone on that.
Yes.
Was there a time in your career where you felt that you were the target of bias or disadvantage because you were a woman, and how did you grapple with that?
So I am very much an exception here. I have really not experienced that. I've not known that I've experienced it. I'm sure that over the course of my career, there were jobs that I did not get, that I was more qualified for, that went to a man, but it wasn't the ones I asked for. And so I think in that sense, yes, and I hope things are much better now. But I have been incredibly lucky to be surrounded by great men and women who are professionals, where our relationship really was one of, a rising tide rises all ships. And to the extent that there was always a need for more leadership and more kind of higher level folks, it really wasn't a competition. I'm not saying that's true today, and maybe that's why it's more important to stand out and ask for what you want. But I really can't say that it was my experience.
Great, Marianne, I'm going to go over here and get another question, but you're in the position of being a mentor. How do you vet who to spend your time with mentoring, and what are the keys for people to approach you, and what is some of the things that they shouldn't do? Anyone can approach me once. I do think if you want to use someone's time, as I said before, you have to have a plan. You have to have an idea. If you don't have an idea of what you want, you have to be open to everything, and then you have to act on it. And I would say what I said before also, if someone is coming to me more for consolation than for kind of advice going forward, that's not a value exchange for us. I'll offer it, but I'll offer it and then say, I think you need to kind of think back through what it is you think you want or where you are. We all make incredibly tough choices, and I respect, and I think people sometimes need help in respecting their own decisions, whether it's about work life, children, and when you stay home and when you don't, how much travel you have to do, because travel obviously wreaks havoc on our lives. And I try to help people get comfortable with those decisions first, because they're obviously more important to their kind of work family ethic. And I think if people get comfortable with those decisions, they can get comfortable with how to make other decisions.
Mm-hmm. So, Marianne, you are an inspiration to us all. Thank you for your very poignant comments. I really enjoyed it. So I have a question for you. We were talking about this earlier, which is that, at entry level, there's a parity between females and males. It's about split, 50-50%. But as the scope and responsibilities of each level increases, that disparity becomes wider and wider, to the point where at the very senior levels, the split is about an 80-20%. In your opinion, what's the reason for that? And you did mention that women need to ask for it, but are there other dynamics that you've observed that cause that to happen?
Well, I think for a very long time, it was allowed to happen in large corporations, where there was no kind of check and balance against who was being considered for jobs, and then the outcome of who was being offered jobs. And I'll give an example that I think is quite incredible. There is no probably more testosterone-driven sport than football. I don't follow it, but that's my impression of it. And even in that sport, they have what they call the Rooney Rule, or the Rooney Rule, which is no position can be considered without a full slate of candidates. And you force people to look further and choose. It's easy for us to always go to an easy choice and choose someone we know, but that doesn't make diversity work. One of the things that I've seen and done is, when you have resumes, take the names off them. So the first time you look at a resume, have no idea whether you're looking at a candidate who is a male, female, and let that keeps you a little bit more honest in whether someone really fits the job. And I think that's something we can all do. But I also think as leaders, it's our responsibility to ensure that parity comes back into play, and that as long as you keep it up the whole time, it will naturally float up to the top. But it does still take, unfortunately, it still does take energy and observance and purposeful attention to ensure that you stay you have parity all the way up through levels. My company, by the way, 47% women executives and 46% women overall. Fabulous women, fabulous.
Marianne, you said something just now about the decisions you help your mentees make about their their desire for a work-life balance and family and all that. And it also harkened back to something I think you said earlier about, especially early in your career, working hard and working long in order to put yourself in a position to be successful. Do you think that companies have a role to play in making it easier to have a work-life balance so that more women, particularly early in their careers, can be successful? And what are the changes that have to happen kind of at the board and corporate level in order to make that more possible for all of us?
So I think it's completely possible in the, in a world today where there's so much more virtual job sharing and virtual participation. That alone is easy. It's also, quite frankly, from a corporate perspective, you can save money in running your company if you allow people to work remotely, because then you're not paying for the occupancy space on your campus. So it's a win-win both ways. I don't think it just applies to women. I chose to work long and hard. That's my personality, but I do that across every part of my life. For other people, there's absolutely ways to find balance. But you have the right to ask for it, and as long as you're delivering value, you have the right to conduct yourself that way. And again, I don't think that's just a female issue anymore. I think it's a career issue that everyone has to at some point check in on and make a decision about. But I do honestly think it's easier in the kind of the construct of the workplace today.
And we have time for about one more question. That's right there. And then we'll have time afterwards to mill about and ask more questions.
Hi, Marianne. You mentioned that you joined Lantheus. You were asked to join Lantheus to fix it. I'm curious as to what needed to be fixed, but more so than that, the fact that you had a double-edged sword on you. One, that you lacked the knowledge about the company, which you mentioned, and two, that you were a woman and you had to go in, learn everything, gain everyone's respect and trust. And how were you able to go in and change whatever needed to be changed for the company to make it successful?
So the fix-it part is easy. The company was in fairly significant financial distress, and the runway of available funds to continue running the company was, the end was within sight. And so it actually made it a little easier because it was very obvious. And that was one of my first kind of stands for the company is we can either all decide that some of us will make it, or we can let this incredible company that's been at that time present for 55 years in the Boston community run out its course. And no one wanted the latter choice. So there was fairly strong agreement that we needed to take fairly draconian measures to get the company stable again so that we could start building it again. My ability to do that, I think, was driven by my sincerity. I was there, I was one of them. I was obviously, if the company didn't make it, I wouldn't make it, and neither would the rest of executives, and that's the way we conducted ourselves. We took really strong steps to curtail any type of spending, and that was done top to bottom. There was no kind of levels and differences there, and we were really outspoken and obvious about it while it was happening, and then while it started recovering, we were really again, fairly internally public about showing the progress that we made. And we ended up having the opportunity to go public in 2015, mid-2015. I was named CEO right after that. My great friend and predecessor left the company for very valid reasons, and then I was given this amazing opportunity, and we just haven't stopped. That's a very strong current now through the company, is everyone benefits from the success, and everyone is kind of proud to be part of it. So I think I will tell you, I feel like they wrapped their arms around me and said, if that energy level is true and it's pointed at us, then we're with you.